Good morning. My name is David Cook. I'm the Senior Policy Manager for the Alzheimer's Association. Welcome to the 2023 Alzheimer's and Dementia Awareness Day at the Capitol. Thank you to, I'm going to say Attorney General, but Lieutenant Governor Rutledge, Senator Hill, and Representative Mayberry for joining us today as part of our program. We are certainly thankful for all of our partners, the UAMS Centers on Aging, the Department of Human Services, the Department of Health, the Arkansas Healthcare Association. I'm going to miss some, but all of our stakeholders who've been engaged around the table in passing and approving the update to the Alzheimer's State Plan, the first one in the state since 2011. So in 2022, we passed an update to the state plan, and we couldn't have done it with all of our without the help of our supporters.
Welcome. Good morning. It's so nice to see so many supporters out here joining us today, and of course our many partners who we could not do this without. We're here today at the Capitol for the 2023 Alzheimer's and Dementia Awareness Day. Alzheimer's disease and other dementias impact our state government budget, our healthcare workforce, state agencies, families, and Medicaid spending. It is essential that every state have a comprehensive plan to address this rising epidemic. And Arkansas made this a priority. In 2021, by establishing a permanent Alzheimer's and Dementia Advisory Council. With the help of our partners, in October of 2022, we released the first update to the Arkansas Alzheimer's and Dementia State Disease Plan in over a decade. Through this plan, we have already been able to work with lawmakers to pass legislation establishing dementia training standards for home care providers to ensure those who prefer to age in place are receiving optimal dementia care.
So thank you to the Alzheimer's Association and all of those who are working to advocate for those living with Alzheimer's or dementia or some other illness in this area. As Kirsten mentioned, nearly 60,000 Arkansans are impacted right now and living with this terrible disease. That soon will probably be 67,000. And I am no stranger to it. My grandmother had Alzheimer's. This past spring, I lost an aunt I was very close to. My best friend's mother had Alzheimer's. She passed away in her 60s. And now someone very close to me has it. And that's why we're fighting here in the state capitol to advocate for those who are suffering from these terrible diseases that strip you of your memories. They strip you of your love. It strips you of your dignity. But together, we're going to keep fighting because our mamas, our dads, our grandparents, and someday one of us will need people like that are in this room fighting for us.
I'm Senator Ricky Hill, and as usual, when you go behind the Lieutenant Governor, there's nothing left to say. She covers it all, and she does it very eloquently. As I was sitting in my office a while ago trying to think what to say today, the memories of my mother who had this disease for 10 years started going through my mind. You get kind of emotional thinking about it. And I will tell you the most impactful statement, and it has given me drive as well, is one day when my mother looked at me and said, "Who are you?" Devastated. How does my mom not know who I am? It hurts. To this day it hurts. But she didn't know it. She didn't know what she was saying, because she didn't have a clue who I was. It wasn't that she was making it up and trying to hurt me. It was that she literally did not know. But you know what? Hearing those words, "Who are you?" gave me a cause and a drive to be here today. God put that disease on my family, that awful disease, for me to come forward and be a spokesperson for that disease, to step forward and do what's right. Put me in a position that I'm very fortunate to be in now, where I can have a public forum and say, anyone that has not been affected by Alzheimer's or dementia, get ready, it's coming. And at that point, you will totally understand what we're saying.
So when I was about 3-4 years old, my grandmother moved in with us. And it was the beginning stage where Grandma can no longer live on her own. She would leave the stove on. And over time, my sweet grandmother, her personality began to change. And that is really hard to watch, even as a little girl, you know, watching this really sweet person have these moments where they're accusing someone of doing something that they didn't do. And it was just really hard, and I saw at a very young age. My grandmother ended up passing away when I was about 11. I saw the toll that it took on my mom, the work that my mom wasn't able to do out of the house because she was caring for my grandmother. It was a team effort. Everybody, my mom raised 5 children. She was a single mom. Everybody pitched in to help with my mom. But what I didn't know then is how that would prepare me for what we just went through as a family, and that's watching my own mom go through that. My mom lived with my sister, and the toll that it took on my sister, now that my mom has passed, I'm after her saying, you need to go get some checkups. Because she really put her own health on hold. She's got a CAT scan coming up later this month and all that. She dedicated her life to helping to take care of my mom. So looking forward to continuing to do more work. It is close to home. It's close to home to many legislators as we begin talking up there. And you have a commitment from me that we will work hard to do what we can.
We have one of the most aggressive policy platforms that we've had in at least our modern history. So we have several bills that are making their ways through the process. We're excited to announce, first and foremost, that the Department of Human Services has included $200,000 into their budget to ensure that the Dementia Respite Care Program is continuing to be funding. So thank you so much, DHS, for your partnership in that work. Here in this session, we have breaking news. We advanced legislation through the House and the Senate, House Bill 1267. It established, that was carried by Representative Mayberry on the House side and Senator Clint Penzo on the Senate. House Bill 1267 establishes 4 hours of dementia training for home care providers. That bill was actually signed into law yesterday by Governor Sanders. So it is now, last week, Representative Dwight Tosh filed House Bill 1396. That bill is carried in the Senate by Senator Hill. That bill will establish 2 hours of at least 2 hours of dementia-specific training for members of law enforcement and our first responders to ensure that they are prepared to make interventions and interact with individuals who are living with dementia. We know that our first responders and our members of law enforcement have frequent interactions with our populations. As Kirsten mentioned, Alzheimer's impacts multiple aspects of our state Medicaid program, our workforce, particularly our healthcare workforce. So it's essential that Arkansas have a coordinated response to Alzheimer's and dementia, especially as case prevalence continues to rise. Having this piece in place, similar legislation has been filed in Tennessee and Oklahoma, and we're hopeful that Arkansas will join them as well in the next few weeks. And last but not least, in the next couple of weeks, you'll be hearing more from us about this bill. We have a bill that's specific to assisted living communities that will require some dementia training for their direct care staff as well. So we're looking forward to continuing to work on that bill with our partners, and we expect an announcement in the next couple of weeks on that bill as well. So we have a lot to work on. We have a lot of work to do. Alzheimer's is not stopping, and neither are we. So we're going to continue to move forward to make sure that Arkansas continues to coordinate its response for the populations that we serve. I want to thank